the Rocket Right Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes, and our medical segment is brought to you each week by Bird Perkins, Our Lady of the Lake Cancer Center, and we are so glad to be talking with Dr. Catherine Castle today, who's a radiation oncologist at the Breast and GYN Cancer Pavilion, which is a partnership between Women's Hospital and Bird Perkins, Our Lady of the Lake Cancer Center, two great places joining forces.
Yes,
thanks for joining us today.
My pleasure.
And of course, from being a OBGYN in town for I think 27 years before my retirement, I always remember that September is GYN or gynecological. If somebody wants to get the whole word out, I think everybody abbreviates it as GYN because they can get tongue-tied saying gynecological.
Yes.
Cancer Awareness Month. But let's talk about GYN cancers because it encompasses a lot of different female cancers.
Yes, that's correct. So GYN cancer is really a cancer that develops in any part of a woman's reproductive tract, and we sort of separate it into 5 groups based on which part it develops in. So in order of the most common to the least common, that can be uterine, or also known as endometrial cancer, ovarian cancer, cervical cancer, vaginal cancer, or vulvar cancer. And really any woman that has those organs is at risk of developing a gynecologic cancer.
Absolutely. And so a lot of women, think, well, how can I get that? Or just the word GYN cancer. There's a bunch of different ones depending on the part. Some are more common than others. Like you said, you went, and endometrial, when you said that, that's from the lining of the uterus on the womb, which is also called uterine. But let's talk about some of the common risk factors for developing gynecologic cancers, because there are some specific ones for certain cancers, but there's some in general.
That's correct. So the risk increases with age for all of them. The human papillomavirus, also known as HPV, which commonly affects many women without them even knowing, is a risk factor for cancers of the lower reproductive tract. So that includes the cervix, the vagina, or the vulva. Smoking is also a risk factor and actually doubles the risk for cervical cancer.
Absolutely. And patients, when they would have an abnormal pap smear, they would have precancer cells that would be treated, they would go, "Doc, what can I do to not have this come back?" I'm like, if you're a smoker, quit smoking. And they're like, how does that affect my cervix?
Yeah.
It does. They just don't put it together. Yeah. But because of the carcinogens, the cervix loves to have that, and like you said, it doubles their risk. And anyone who has had precancerous cells has HPV. The biggest thing they can do for themselves is to stop smoking if they're a smoker. But also, you said, and I think a lot of women don't think about this, is that all of those cancers increase with age. Because I can't tell you how many women would tell me, well, I thought I could stop seeing you maybe when I turned 60 or 65 or whatever. I didn't think I could get any of those. No, they actually increase.
Yes, yes.
But I found that women thought at some age
they didn't need to see.
They didn't need to see because those risks went away. And I think some of the new guidelines for screening actually made them think that.
Yeah, yeah.
The guidelines can be very confusing.
They can be. And other risk factors too that I didn't hit on yet that, and I like to talk about it because when we talk about ways to prevent, they sort of tie together. But for uterine cancer, one of the risk factors is actually being overweight or obese.
Which is also a problem with COVID-19.
Yeah.
So absolutely. Smoking is an issue with that. So there's a lot of things you can do to kind of help your health by getting healthy.
And exactly right. And especially for endometrial cancer and uterine cancer, they go, well, why is that? Because fat cells make you make more estrogen. And it's an estrogen sensitive cancer. And so if you lose weight and you have less body fat, then you have less excess estrogen.
Exactly.
That stimulates the lining of the uterus. And so sometimes you have to explain that because a lot of people
I don't think that's
understand the correlation.
But you know, with lots of other cancers, it's the increased inflammation there, which probably plays a factor,
some role
as well.
But do you think that message is really getting out there? Because I don't. I don't think that message is out there as much. There's about self-screening for breast cancer and other things, but I don't think that there's a method of messaging that's frequent enough to say being overweight, smoking increases your risk for gynecological cancers. I just don't hear that, and I think a lot of women don't know that.
I think you're probably right, which is why opportunities like this are great to be able to provide some of that information.
Some people are afraid to broach that weight issue, which is causes so many of our health issues, not just the gynecologic cancers, but numerous, and we could talk about that in the future. But I think you were probably going to, get to the rest of your list, which one of them is family history.
Family history, yes, and that is important. Having a family history of cancer can increase the risk of developing a gynecologic cancer, and I tell patients they should let their gynecologist know about any family history of cancer, because certainly ovarian can increase the risk of ovarian, but patients with family history of colorectal cancer can have a genetic mutation that's associated with uterine cancer. So it's really all very important to know that about your family if you have that information, and share it with your primary care physician and your gynecologist.
Because there are some testing that can be done to see if you carry a gene for some of those, and there may be some preventive things that you can do if you carry a gene that increases your risk. But I know we're talking in generalities, and I think we need to have you come back and talk in specifics, because there's so many different things. But let's talk about some of the symptoms, that women should look out for.
Yeah, and so one of the tough things about gynecologic cancers is sometimes symptoms can be very vague, and I often tell my patients who have large tumors that didn't have many symptoms that a woman's pelvis is designed to carry a baby, so you can actually have a large tumor developing and minimal symptoms. So at the earliest sign of symptoms, anything abnormal, they should seek care from their provider. But things that are probably the most important are severe pain or bleeding with intercourse or immediately following intercourse, or for a woman who has gone through menopause, there is no vaginal bleeding that is normal after a woman has gone through menopause.
Absolutely. And people rationalize things. I had one lady, she goes, well, my granddaughter moved in with me, and, she started up here, and I just thought I was starting to cycle with her. It's like, no, that's not right.
That's not right.
No, that doesn't happen. So once you've been a year without a cycle and are menopausal, you should never bleed again. And if you do, it's a problem you need to see your doctor about. It doesn't mean it's cancer, but there's something that
going
needs to be evaluated. For sure. Yeah. So let's talk about screening, because a lot of times, as you said, there are no symptoms, and these cancers are picked up on screening.
Yes. So the only formal screening test that we have for gynecologic cancers is for cervical cancer, and that's a Pap smear. And that can detect changes in the cervix that are precancerous or cancer before a woman even has symptoms. And by identifying that, then it can be treated and managed either before it becomes cancer or at a very early stage of cancer.
Absolutely. And even though the others do not have screening, there still is a big point for seeing your doctor on an annual checkup, because maybe they notice a discoloration in the vulvar area that you didn't see. That could be a skin cancer or a skin change that wasn't there before that you're not going to pick up. Or again, you said they can carry masses in the abdomen and not even know it, and can be picked up by your gynecologic exam if you're going annually. So there's still, in addition to the Pap smear, a place to be seeing your physician on a regular basis.
And this month would be a great month to make an appointment, because we're past the point where physicians are discouraging people from coming in, and it's time. This would be a good time. If you love someone, if you love a woman, send her to her doctor. Let her go and see her doctor. It's so important.
Absolutely. So that's one of the things we were going to talk about.
Yes. People should still be
doing their screening.
We have taken every precaution to keep women safe, at the Breast and GYN Cancer Pavilion, and it is so crucial that these women continue to get screened. We talk a lot in our world about the concern of women not being screened and the advanced cancers we may see as a result of this.
Absolutely, and I think people have put it off, and I think we're going to see some different statistics next year when we look at that. But real quickly, we don't have much time. If someone finds themselves being diagnosed with a GYN cancer, what should they do? Now, hopefully they're seeing a physician. They're going to help guide them, but there's some additional resources.
Yes. So at the Breast and GYN Cancer Pavilion, our focus is exclusively breast and GYN cancer. So we have specialists from every discipline to address all the needs of the patients. We have clinical trials. But for a woman who is newly diagnosed with a lot of questions, one of the great resources that we have is something called Cancer Answers hotline that's answered during business hours, and the number for that is 225-215-7600. And that's for a woman. Sometimes a woman even gets an abnormal pap result and has questions about it.
Absolutely, and I think that's a great thing, because I've always told my patients, they're like, well, I didn't call because I didn't want to bother you. I didn't want to call back, and so they're afraid to bother the doctor. There's no question that is not important if you have it in your mind, but this is a great resource that people can call and get answers to, as well as they should always feel comfortable talking to their physician about that. Thank you so much, and we're going to share that number on our Facebook page at Rocket Right Radio, and we've been talking with Dr. Catherine Castle. September is GYN Cancer Awareness Month, so we want to say make sure that you're up to date with your screening. Make sure that you've seen your physician, because we don't want you to be in one of those statistics that I think we can prevent.